Hello, my name's Louise Barlow. I'm one of the nurses here on the ward.
Hi, Louise.
Hi. Is it alright if I take a seat and just ask you a
That'd
few
be
questions?
lovely.
Is that okay? Right. What brings you here today? Tell me a little bit more about what brings you here.
Well, I've been seeing the surgeon here at the hospital for a while now because of my hip. I've had problems with my hip, and I think he's decided it's time now, even though I was a bit reluctant at first, to have the hip operation.
Things have been getting progressively worse and
Yeah.
it's time now, okay. Is it alright if I just ask you a few questions about how you've been getting on and just get a few details from you?
Yeah, that'd be lovely.
Lovely, okay. So it's Susan Brown, isn't
It
it? Is that
is.
right? Okay. And do you like to be called Susan or?
No, Sue. Just call me
Okay.
Sue, Louise.
Lovely. And you're happy for everyone to call you Sue?
Yes,
Okay.
absolutely.
Brilliant. You're looking a bit uncomfortable there. Do you want me to
Yeah,
just
I am a
pop
little
pillow? Do
bit.
you want a pillow? Just
That would be
to lean
lovely,
back?
thank you.
There we go. Let's just pop that.
Thank you very much.
Yes, is that comfortable for
Lovely.
you? Can I just confirm your date of birth?
It's the 4th of December, 1965.
Lovely. So that makes you
49.
49.
Nearly
Lovely.
50.
Big birthday next year. Yeah, lovely. Can you just tell me your address, Sue?
It's 174
Yeah.
Privet Drive,
Okay.
Wolverhampton.
And do you have the postcode?
I do. It's WV12
Yes.
3RT.
Lovely. And do you have a home telephone number there?
Yeah, at home it's 01902
Yes.
425
Yeah.
425.
Brilliant. Okay. And other than your home phone, do you have any other means of contact? Do you have a mobile?
Yes, I have a mobile in my bag.
Okay. And do you have the number with you?
Oh, 0773
Yeah.
42 4235.
That's lovely. And in terms of home, is it a house that you live in, Sue, or a bungalow, or a flat?
Yeah, it's a
or...
proper house stairs, unfortunately.
Okay, all right. So have you been finding that a bit difficult?
Yes, yeah, very much so. It's an old house, so the stairs are quite steep,
Yeah. Right. Okay.
which makes it even worse, I think.
And does anyone else live in the house with you?
Just my husband now.
Okay.
I have a son, but he's just left to go to university.
Oh, lovely. So
Yeah.
it's been busy times.
I know,
yeah,
backward
yeah.
and forward to get him moved in at university.
Absolutely. Do you have any pets or any other
Just a
dependents?
cat.
Okay.
But he's
cat.
quite independent.
Okay. I'll just get you next of kin details. So would that be your husband?
Yes, it will be.
And what's your husband's name?
Robert.
Robert. And is he got Robert Brown, is it?
Yes.
Yeah. And he lives at the same
He
address
does
as you?
indeed.
Does he have a contact number other than your home number?
He does. 0793
Yeah.
442
Yeah.
34547.
Yes. Is Robert aware of the reason for your admission and the fact that
Yes,
you're coming in
he's
for
actually just
operation?
outside, I think, parking the car.
Okay, all right. So he's
Yeah,
aware of
he
everything
is,
that's been
yeah.
going on. That's lovely. In terms of your general practitioner, Sue, do you know your GP's name?
Yes, it's Dr. Singh at the
Okay.
Meadows Healthcare Centre.
And other than your GP and Mr. Martin, have you seen anybody else in relation to the problem with your hip?
Yeah, Mr. Martin referred me to the physiotherapist.
Okay, lovely.
And they've started treatment. I've seen them for the last 5 weeks.
Excellent.
In preparation, I think.
Yes, and is it the physiotherapist based here at the
It
hospital?
is, yeah.
Okay, so they're going to be
Yeah.
continuing on your care
They will be,
post-operatively.
yes.
That's lovely. Brilliant. Other than that, have you had any other home care teams, anybody coming out to help you within the
No.
house? Okay. Okay, so in terms of your general health, any other sort of illnesses, any operations have you had previously, or things you have to see the GP regularly for?
I have blood pressure problems.
Right, okay.
So I do take medication for that.
Okay.
I did take Ramipril, I think first, but that didn't suit me at all.
Okay.
I got cough and felt unwell.
Right,
on
okay, so
Ramipril.
you had an allergic response to the
Yes,
Ramipril,
yeah.
okay.
So now I take Imi something
Is that indapamide?
That's the one.
Is it good? Okay.
and something else, but I've brought all my tablets with me.
Right, okay, lovely.
Today.
We'll have a close look at those in a little while, okay. Is your blood pressure being well controlled?
Yeah, it has. Yeah, it
Okay.
has. I haven't had any more problems with that.
Okay.
I've only ever really been in hospital before for anything. When I was a child, I had my appendix out,
okay,
but I've had nothing surgery-wise at all.
Okay, so other than the blood pressure and the appendix, nothing else in terms of your medical history.
No.
And in terms of your medication, you're on the 2 blood pressure medications, and we'll check those out in a little bit. Are you on any pain medication at all for the hip?
Yes, I have coproximal and naproxen.
Okay.
Currently, and they upset my tummy a little bit,
right,
so
okay.
I take omeprazole as well.
All right, and how's the tummy been since you've been on the
okay,
omeprazole?
great,
been fine.
yeah.
And do you take the coproximal and the naproxen regularly? Do you take
yes,
it as
I do
prescribed
have
by
to.
the doctor? Yeah.
They did try me originally with the patches.
Okay.
With the morphine patches?
Yes.
But they made me feel really quite unwell.
Okay.
Unsteady.
Right.
So we just keep with the coproximal and the naproxen now.
Okay. And is the pain controlled with that?
It takes the edge off, but I still
Right.
get quite uncomfortable.
Okay.
And sometimes I have to take night off
Right.
to sleep, because once I get into bed and you get stuck in a position, it gets quite uncomfortable.
Okay. So you buy Nitol over the counter?
Yeah, I do.
Do you buy anything else over the counter? Any other tablets that you take regularly?
Not regularly, but I do have Benadryl
Okay.
for allergies as and
Yes.
when.
Okay. And is that just sort of hay fever allergies? Or
Yeah.
Okay. So other than that, do you sort of purchase any herbal remedies or anything like that? Any supplements,
No.
vitamins? No. So in terms of your allergies, you say that you're allergic to the Ramipril that made you cough. Did it? So they stopped
It
that.
did.
Okay. Any other allergies that you know of?
No.
No. Okay. Right. Okay. So obviously you're here today for your operation. What are your feelings around sort of coming in for an operation of this nature?
A little bit nervous.
Yeah.
Yeah, I've never had a big operation like this really.
Okay.
So a little bit concerned. I'm not used to being in the hospital.
Yeah. I can
Yeah.
understand why you feel like that. We're here to answer any questions, concerns, anything you need. You just ask the team, okay, either the
Great.
nursing team or the medical team, okay? And we can support you and your family through the admission.
Thank you.
Okay, all right. On the positive side, hopefully things will be a lot better when you've had your operation, so it'll be nice to see you
I'm
recovering
hoping
and-
so.
Absolutely, absolutely. Yeah, I can understand how you feel. All right.
Thank you very much.
Is it okay now if we just go on and have a little chat about some of your daily activities? Okay, I just need to know how really the hip has been affecting you on a day-to-day basis, and talk about things that we need to support you from a nursing perspective while you're in
Yeah,
hospital.
no problem.
Is that okay?
Yeah.
First of all, at the moment, you're able to sort of get up and mobilise and so forth, aren't you, to a degree?
Yes.
How far would you be able to walk?
I can potter about the house.
Okay.
Although it's uncomfortable.
Right.
That's not a problem. When it comes to going up the stairs,
Yeah,
that
that's
becomes
one
a
of the big
huge issue.
things.
I can probably potter about for 10-15 minutes before I really have to take the weight off it and have a little rest.
Okay.
Now.
Yeah. You're able to transfer from a chair safely?
Yes, yeah, no problem.
So you've not had any problems with any
No.
falls or anything in
No.
the home? Okay, that's lovely. Obviously, after the operation, there'll be a period of time when you will be needing to be sort of within the bed, okay? Normally we get you up after sort of the next day after having a hip operation, but after the procedure, you'll be in bed. Obviously, you won't be able to mobilise like you have been, okay? We'll be here, all right? You'll have a buzzer, you'll be able to contact us, and we'll come to you if you need any assistance, so please don't feel worried or sort of isolated after the operation, okay?
The physiotherapist said they'd get me up the next day. That's
Absolutely.
quite quick, isn't it?
It is.
That's quite soon.
Yeah, we make sure that your pain medication is very well controlled, so that your pain is at a good level, and obviously they're very experienced, and it's important that we get you out of bed, because we can run into complications if you're lying in bed for a long time. So don't worry. I know people feel anxious, and I've had people express concerns before, but it's a regular procedure, and we do it, and you'll be fine. Okay, we'll support you through. All right. Just a few questions about your general health. Do you have any problems with your breathing at all? Any problems there? Have you been a smoker in the past? Or have you lived with a smoker
never been a
at home?
smoker. No, my husband doesn't smoke.
Good, okay.
Only the coughing when I was on the Ramapril.
Okay, but other than that, nothing.
No.
You've not had asthma in the past or anything?
No,
like
not
that.
at all.
Lovely. Okay. And what about at night? Do you snore when you're asleep?
No, I don't snore. But I do, because I have the acid reflux.
Right.
So sometimes if I'm laying too low,
Okay.
it'll wake me up and I'll cough.
So do you have to sleep with a number of pillows?
4, yeah.
Oh, 4
I have the whole 4 pillows. I'm quite
Okay.
upright when I sleep.
All right, well, we've got 3 here today. We'll
Yeah.
sort that out for you so that you're comfortable and things aren't made
That's
worse
lovely.
whilst you're in here. But please let us know if you need anything extra.
Thank you.
Okay. Your main language is English. You're speaking to me
It
in
is,
English today.
yes.
And you've not got any problems with your hearing or anything
No.
like that you've got any concerns about?
No.
You don't need any sort of support or anything
No, not
while
at
you're in
all.
hospital, lovely. And in terms of pain, what we normally try and do when people are in hospital is use what we call a pain scale. Okay, so
All right.
I can tell when you're walking in, I can tell by your expression that you are in a degree of pain, particularly when you're walking. But what we like you to do is try and verbalise that and let us know so that we can help with your pain medication. All right.
Okay.
So after we've done the assessment, I'll spend a little bit of time talking about pain scales and things like that, and it's something that we can use after your operation as well. So
Lovely.
you can tell us, where along a scale of 0 to 10 your pain is, 0 being you're fine, no pain, 10 being the worst pain you've ever had. But
Lovely.
we'll spend some time doing that
Okay,
a bit
that's
later. Okay. In terms of your mobilising, and you've been limited to sort of walking short distances, have you been using any aids at home? Have you had a walking stick?
I have actually got a walking stick,
Okay.
but I only use it if I'm out of the house, and
Okay.
I'm going to be walking quite a lot.
Yeah.
So just before I stopped work, I had the walking stick for work because the long corridors could be
Yeah.
quite challenging at the school.
Absolutely. Yeah, okay. So again, after the operation, the physios will do an assessment. So it may mean that you need 2 sticks to start off with,
Yeah.
and then things can decrease. But we will monitor your mobility after the operation. You will have your nurse call buzzer. You won't be able to get up out the chair on your own for the first day or 2. So we just need you to be aware of these things post-operatively.
Lovely.
Have you got any concerns about that at this stage, or?
No, I don't think
No,
so.
Okay, we're here to help, so just don't worry about that, okay?
Lovely.
Any problems at home, sort of doing your shopping, getting your food?
No,
prepared?
I've got plenty of help.
Okay.
My mother-in-law lives locally, so
Lovely,
I've got plenty
okay.
of help. So I don't think that's a problem.
So you've got a nice support
Yeah.
mechanism. Okay, that's lovely. Have you had any problems with sort of digestion, any problems with swallowing or so forth? You said you've got an irritated tummy.
Yeah, which is why I take the omeprazole.
Okay.
But as long as I keep off spicy foods,
Okay, all
yeah,
right.
no curries or anything like that. That's
Okay,
too
spicy.
spicy.
All right.
And
so you know the type of food
yes,
that
yeah.
obviously in hospital we have a wide range of on the menu that you'll be able to choose your options from. Have you got any sort of preferences or any dislikes for foods that we need to know about? Any cultural things that we need to be aware of?
No, I don't think so. As long as it's quite plain.
Okay, that's fine.
Yeah, it's
Yeah.
just spicy. I think that's my biggest issue.
Okay.
And cheese is an
You
issue.
avoid. Okay, that's fine. There should be plenty of options for you. All
Lovely.
right. Just asking you a few more sort of personal type questions. Any problems with sort of going to the toilet at all?
I have been a little bit constipated. I think it's those painkillers.
Right,
It's since I've started
okay.
taking all the painkillers.
Yeah, it
Um,
sometimes can be the codeine in the coproximal that causes the
Yeah.
problem. Have you been doing anything at home to help with the constipation?
Just all bran and some prunes
Fantastic.
every day.
Lovely. And has that kept you going every day?
Yeah, it's helped. It's helped. I know when I don't have the prunes that it goes backwards a little bit. So
Okay, so we need to make sure that we keep an eye on your sort of bowel habits while you're in
Yeah.
hospital here, all right? We do tend to put you on some laxatives, some medicines that help you to open your bowels.
is that like the
okay?
prunes?
It is, but it's a little bit more formal, so we'll
Yeah.
give it you regularly. We
Oh,
don't want
lovely.
you straining after the operation, okay?
Yes.
So it's important that we do that. So please let us know if you're feeling uncomfortable or anything like that, okay?
I will do.
And what about passing urine? Any problems passing urine
No.
at all? No
No.
issues, no blood in your urine, burning,
No,
stinging,
not at
anything.
all.
Lovely. And what about actually using the toilet? Have you been okay at home, or have you had difficulties?
Luckily the sink's next to the toilet, so I can lower myself down.
Okay.
Because getting down and getting up can be a little bit of an issue.
Yeah, absolutely.
With the hip, but apart from that, no.
Okay, lovely. All right. What we will do here, and what we do have in the toilet, is some raised seats, okay? So it helps you getting from a sort of sitting to a standing position, and there's also handrails within the toilet facilities, so it will help you with that. And all the toilets have got nurse call facilities. I know sometimes it can be a little bit embarrassing for patients who don't have to normally ask for our help, but we're here to help you if there's any concerns when you're in that situation, okay?
Lovely, thank you.
In terms of after the operation, normally we pop a catheter in. Have you heard about catheters before?
Yes, I have.
Okay, so
I'm not looking forward to that.
No, absolutely. We tend to put them in after the operation because obviously you can't mobilise as well, but we do try and get them removed as quickly as possible after the procedure as possible, as we can. So it normally is the next day as we're getting you out of bed, and then we can at least ensure that you can transfer to the commode or to the toilet.
That's great.
What we will have to be doing is sort of checking how much urine, so don't worry if we're checking your catheter frequently. It's just so we can keep an eye on things, all right? You do need to let us know how much you're drinking, and we will be encouraging you to drink as much after the operation, all right? So your husband's welcome to bring in some juices to add to the water if you want something like that, just so it's
lovely.
nicer.
I'll get him to do that.
Lovely, all right. Okay, so in terms of other hygiene-ish problems at home, any problems with sort of showering, bathing?
I haven't been able to get in and out of the bath.
Right, okay. Has that been a problem for you?
We do have a shower, a downstairs shower and toilet room, so that's been fantastic. Good. But standing for a long time in one position is also an issue. Yeah. So I actually bought a plastic stool, a high plastic stool that I can just sort of perch on while I'm in the shower.
Okay, and that's safe and stable within the shower. Lovely. Okay, so obviously while you're here, we've got the facilities, sort of the single sex facilities off the ward, okay, so that you'll be able to go away and have your shower with the facility to have help if you need it. Okay.
Lovely.
After the operation, we tend to just give you a sort of a bath in bed, if that's okay. How do you feel about having...
I'm not looking forward to that. I'll do as much as I can myself.
Absolutely, and we really encourage that. We really do, because obviously, it's not a normal activity for yourself. So there's certain things that you'll be able to do. But it's important for you to let us know if you feel uncomfortable or you need a wash at any particular time, because everyone's different. But please let us know.
I will do.
And we'll facilitate it if we can. Before you go home, we will get the occupational therapist to come out and do an assessment of your home, okay? So they will go and look at aids which will help you. I know the physios have probably already talked to you about the fact that you won't be able to do lots of bending or lots of sort of standing, sitting and so forth, and you'll need your chairs at specific heights. So we'll get all that sorted out for you before you go home. All right.
That's great.
That's lovely. Okay, so just moving on a little bit, any problems before you came into hospital with sort of temperatures, fevers, anything like that? You've not had a cold recently?
No, not at all. I've been quite well apart from this hip.
Fantastic, lovely. And in terms of how you like to be, do you like to be warm or do you like to be cool?
I like to be nice and warm.
I like to be nice and warm, okay. So we've got one sheet on and one blanket on the bed, but if you do need extra, please let us know, okay, so that we can keep you nice and warm after the operation. Okay, and obviously you're not going to be able to do that yourself for the first few hours after the operation, so again, press the button and let us know. So obviously from what I've understood so far, it has had quite an impact on your sort of activities at home and at work, Do you want to tell me a little bit more about how it's affected you?
Well, before I started having problems with the hip, I was a keen runner.
Right,
I used to run. I did road running with my husband. And I was doing half marathons at one point. So, I mean, the last year and a half, really, I've done virtually nothing.
Okay.
I put on a lot of weight, put on about 2.5 stone.
Right, okay.
Which is a bit depressing.
Yeah.
And obviously very busy with work. And a teenage son, driving backwards and forwards, ferrying about. So I had a very active lifestyle before all this started.
Absolutely. So hopefully things will improve post, after the operation, which is really encouraging for you. I can see you're really motivated to get back to where you were.
Absolutely. And Mr. Martin even said that I might be able to start running again.
Oh, fantastic. So that would be really good for you, because it's obviously something you enjoy doing.
It is, very much so.
Now, we've discussed a lot, haven't we? So you've been an active lady up until now and very busy with your home life and your full-time work as a teacher. So you've said how sort of that's made you feel a little bit down and so forth recently.
It has, yeah. I've put on a lot of weight, and it is a little bit depressing.
Okay.
Yeah.
And how's that made you feel generally about yourself?
A bit down and not very attractive.
Yeah.
It's not nice.
No.
When you can't keep as fit and active as you were, and you look different.
Yeah.
So it is.
And how's that been in terms of your relationship with your husband? Has that caused?
Well, what with feeling unattractive and putting on so much weight, and the hip and the pain, and the weight doesn't help the pain as well. So we haven't really been intimate for a while. So I'm hoping that once it's all fixed, we can get back on track and I can get back to my normal self.
And you're not on your own. A lot of people experience these types of problems when they've got issues such as the hip and the pain, and things do improve, and we can support you after the operation. Your general practice team can support you if you've got any concerns after that. All right. Just moving on to your sleeping. You said that the pain disturbs you during the night.
It does, yes.
And you take the Nitol over the counter, is that right?
Yeah,
okay.
Just get it from the local chemist.
Okay, all right. So it's obviously not something that we routinely prescribe at hospital. It is sort of an over-the-counter medication, and we don't encourage patients to take over-the-counter medication whilst they're in hospital.
Okay.
We'd like to be aware of everything that you're taking, if that's okay.
Yeah.
What we will say is that we will try and get your pain sort of maintained at a good level, and try and optimise your pain management so that things are a little bit more comfortable.
That'd be
but
nice.
Again, absolutely. Again, you need to let us know, and we'll be asking you, as I've said, about your levels of pain at night. We try and keep things as quiet as we can at night. What time do you normally sort of go to bed?
Well, it's been later because once I'm in bed, I can't move as easily, and it's been uncomfortable. So I tend to leave it till about 11 p.m.
Okay, so that coincides well when we're settling down. Really, we usually do the drug round later, about 10 o'clock in the evening, and then things start settling. So, but please let us know if there's any concerns or worries throughout the night. And then just finally, any sort of major concerns, worries, anything that Mr. Martin has told you, that has concerned you about your admission?
Well, we were talking last time I was in to see Mr. Martin. He was telling me about all the risks. And I suppose I've been dwelling on the anaesthetic risks he was talking about.
Yeah.
And it's like, what if I don't wake up?
Absolutely.
And I know it's silly, but that is playing on my mind a little bit.
Yeah, and it's a very natural reaction. It's a reaction that a lot of people have when they come for surgery of this nature. What we do have to do as healthcare professionals is tell you the whole, every single outcome of the procedure, so that you can make an informed decision on whether you want to go ahead with the operation. Okay.
Yes.
So Mr. Martin has told you best case and worst case scenarios. Okay. What I can say is that Mr. Martin is a very experienced surgeon, and we do a lot of these procedures in the hospital. So I'll reassure you that we're very, very skilled at handling this procedure. All right.
That's reassuring.
Okay.
Thank you.
All right. Is there anything else that you would like to tell me while we've got this opportunity to discuss issues?
I don't think so. There is something I've forgotten to tell you.
Okay.
I think I'm allergic to penicillin.
Oh, right,
it was when I was a child many years ago, and I think it's always been on my notes since.
Okay, and did you have a rash when you were
I
a
did,
child?
yes,
Okay.
yes.
So your GP
and I've
has
never had
avoided.
penicillin since. Yeah.
Okay, that's absolutely fine. I'll make sure that our notes and the medical notes are updated. I'll let the medical team know.
Lovely.
Okay, and Is there anything that we've discussed today that has concerned you at all?
No, not at all. I think it's been really clear. Thank you, Louise.
That's lovely. Well, we're here to ask any questions at any time. Please feel free, okay, to ask questions, and your husband if he needs to as well. If I can't find the answer, then I'll find a member of the team who can, all right? So please feel free and relaxed. All right.
Thank you.
Lovely. I'm going to go off now. I'm just going to get your wristband, and we can get you sort of put your wristband on, get your name on the board, and then you can just spend a little bit of time with your husband and get settled into the bed space.
Thank you very much.
Thank you very much for answering the questions today.
It's lovely to meet you.
And you. Take care.
Bye.
So I'm just back to pop your wristbands on, if that's okay.
Okay.
Lovely. Now we give you a wristband because of your allergy, okay? So I've put that you've allergic to penicillin on here. So we'll pop the red one on first, if that's okay. Shall I pop it on your left? Are you left or right-handed?
I'm right-handed.
Lovely. I'll pop it on your left arm so it's out the way.